But the president says that health insurance costs are going down. Instead, they are going up. In fact, healthcare premiums are increasing because of Obamacare. Still, the president calls anybody who criticizes him or Obamacare partisan political enemies.
My friends in the other party have made the idea of preventing these people from getting health care their holy grail, their number one priority, the one unifying principle in the Republican Party at the moment is making sure that 30 million people don't have health care. And presumably repealing all those benefits I just mentioned, kids staying on their parents' plan, seniors getting discounts on their prescription drugs, I guess a return to lifetime limits on insurance, people with pre-existing conditions continuing to be blocked from being able to get health insurance. That's hard to understand as an agenda that is going to strengthen our middle class.
The chorus of opposition against Obamacare is getting louder and louder and louder, and it's becoming more bipartisan. Here now, private medicine advocate and Obamacare expert Patty Newman. Well, the president is out there defending his Obamacare, even though we know that there are more than a few chinks in the armor. We're seeing all kinds of problems out there as we get closer to the October 1st deadline.
That's correct. I mean, there's very different aspects of the law that have been put into place, supposedly with good intentions. You know, one of them being getting all the physicians to adopt electronic health records. The government has done this with the intention of protecting patients, making sure they save money and they don't spend money on duplicate testing, giving the patients the ability to, to get a thumb drive and receive a copy of the records, or sharing the information with other physicians and other hospitals, etc. More importantly, with the government, of course. That's what I think is the plan.
Well, let's talk about these medical health records real quick here. Supposedly, it's designed to help the system move along quicker. Everything goes from paper to electronic or digital. But in fact, what this does is it opens up a whole cornucopia of possible privacy issues.
Right, and that's probably the feature that bothers me the most, that all these records are going to go to the Department of Health and Human Services. And then from there, as we know, they may not be treated with as much privacy as we'd like them to be treated. But more importantly, the government always does these things with good intentions, and then their plans don't pan out to come out the way they wanted them. They've been pushing these providers, giving them $44,000 per provider as an incentive to adopt electronic health records, and then they are seeing that the providers are not adopting the technology as they would want. There's only, the larger groups that have 11 or more physicians in a group that have achieved 57% compliance with electronic health records. Sorry about this, the phone thing.
Well, tell me what the Accountable Care Organization is. I mean, part of Obamacare has set up these echelon upon echelon of government bureaucracy and programs and all kinds of acronyms. This one, the Accountable Care Organization, what is that, and is it working or going to work?
Okay, so the Accountable Care Organization is this large, top-heavy medical organization where the hospital becomes the administrator of all the care that is, trickles down to the patient. So what happens is CMS funds directly to the hospital, and then they decide how they're going to pay all their ancillary services. So you go into the hospital, they pay the hospital first, then for your labs, your x-rays, your all the other costs, and then when you get to the bottom, then the physician gets paid. The problem with this is there's also penalties, because you have to meet certain measures of savings and of performance, that if you don't, you get penalized. So out of the group of 32 ACOs that were in a pilot program, already 28% of the participants fell out of there. They said no more after 1 year.
They couldn't meet the requirements, right? The bar was set too high.
Right. The risk of losing their income as physicians because they didn't meet the requirements was just too costly.
Typical bureaucrats, you know, setting up something in the plastic world that they live in, not the real world that everybody else lives in.
Exactly. And, you know, not only that, there were two groups that just came out because they said they got a $4 million penalty for not reaching the measures. So they said, yeah, no, thank you. We're not going to play, you know, we're not going to play that game.
There's another one out there that was some sort of pay, that is some sort of pay for performance that seems just as bad?
Well, the pay for performance is an idea that applies to all of these schemes by the government. And it also sounds really nice. You know, you perform by getting the patient healthier, and we're going to pay you accordingly. So if the patient gets better, you get paid. If the patient doesn't get better, you don't get paid or you get penalized. So the problem with this, and let me tell you, I call it perform or die.
Yeah.
Either it kills your practice because you didn't meet the measures and they start cutting your pay, or your patient, you know, little old grandma that likes to have that cake every Saturday and her labs are not getting better, well, then you go, you know, grandma, I can't treat you anymore. And then the patient is tagged as a non-compliant patient. Nobody's going to want to see that patient. So either your practice die or your patient die.
Obamacare treats you and me and the whole system like it's a car mechanic. And you're going in there and you're replacing a radiator, and if you don't do it right, you're penalized. But that's not the way human beings are. No one's perfect. Medicine is not a perfect science. We do the best we can, right?
It's an art also. You develop a relationship with a patient, and sometimes that once a week little cake grandma wants to have is fine. You know, nobody's dying on the streets because they didn't have their perfect labs. So this is, again, the government trying to be a parent, and it turns out to be a really bad parent.
Patty, thanks for coming in. Coming up next, Al-Qaeda is alive and well and killing people again as the Daily Ledger continues.